Chris. How are you? Great to see you.
Thank you so much.
Have a seat, my friend.
Sure, thank you.
All right. So, my friends, this is Chris. This is how long out? About 2 months out now.
Yeah,
Right?
2 months.
From a refractive lens exchange. You've had perfect vision your whole life.
Always. I
Always.
was even going to become a fighter pilot.
Yeah.
That's how good the vision was.
Yeah.
I mean, things change, but
The good old 40s come in, right? And so what happened?
about 7 or 8 years, my arm's starting to not be long enough for me
Yes.
to be able to read stuff. So you always see the kids coming in, hey, Dad, look at that. And you're always like, hold on. And it came to the point where it was beyond my arm's length. And
Okay.
that's when you say, hey, I gotta move to glasses. I started wearing readers.
Uh-huh.
Uh,
Just over the counter.
just over the counter.
Yeah.
So I wore those glasses and I started with 0.75.
Yep.
But then year after year, I saw that it was increasing at in my opinion, a very scary rate. So
Sure.
I ended up within 3-4 years, I ended up needing 2.5.
Okay.
Killed it for me is I'm a very active person. I do a lot of outdoor sports. I
Yeah.
like boating. I like kayaking. I like jumping off cliffs, whatever.
Coming with you next time you jump off a cliff.
You swear.
Yeah, I
Let's do it.
I love doing stuff
Let's
like
do it.
that.
And I started having to wear the glasses. Everything that I had to do in any situation, I had to put the glasses and I had to wear them. And I had a pair here and I had a pair here and I had 3 pairs in the truck. And I had, I ended up with 50 pairs scattered around my life. And it was a nuisance.
Yeah.
It was really a nuisance. And so many times someone wants to show me something. I don't have my
Right.
readers with me and I can't see it.
Right.
Driving, I'm driving and I want to see the
Sure.
map system,
Yeah.
and I can't even see, so I have to find. So it was
Right.
dangerous.
Yeah.
So a couple of years back, I said I'm seeing people doing the LASIK thing,
Yeah.
and I'm gonna go and see. So I went to a optometrist, and he recommended LASIK, and he said you're gonna do one eye for reading and one eye for far vision, and I couldn't do it. Then I went a couple of more times, and it was actually really bad because by the time I was convinced and the time that the surgery was going to happen, and I always chickened out.
Okay.
I like last minute, hey, I'm sorry, I can't make it. And then, it was a bit of a lie. Do you want to reschedule? Well, I'll let you know when I
Yeah.
reschedule. I was always so afraid.
You had some cold feet. A
Oh,
couple
yeah.
times, I think you told me, right?
3 times.
I remember the first day I met you here in
Yes.
the office,
Yes.
and you were so open. You were awesome. You said, "Hey, just FYI." It was almost like you're that initial stage where you're getting to know someone, and it's like, I have a history of cold feet.
I was trying to find a way how you could maybe hook me into something that prevents me from getting cold feet again.
Yeah.
And I think what really did it, well, there's a couple of things. First, I do a lot of research. When I want to do something or buy something, or I research a lot. And watching your social media post gave me a lot of confidence because it really showed somebody that knows what he's doing. And you never brag on social media on how many surgeries you do a day, but when we were in the room and you said how many you do in a day, I'm like, man, this man knows what he's done. But when we were here and we were deciding, am I going to do it or am I not? And you said, Chris, what is your biggest problem? And I said, man, in reality, it's time. If you could do the surgery right now, we shake hands, we agree to it, and we do the surgery right now, I'm 100% in. If we do it in a week's time, I don't know what's going to happen. Because especially at nights, my brain was going through
Overdrive.
Man, if something happens, I'm not going to be able to see my daughter. So I was seeing my daughter and my son, and I'm like, what if it is the last time I see them ever? And so when you said, Chris, you want to do it tomorrow morning? And I know you can't do it with everybody, but you said, for you, tomorrow morning, 6 a.m., you're here. I'll do both eyes, 10 minutes, we're out. And I thought, really? And then we shook hands and you said, tomorrow morning. I said, I got you. And then even that night, that was like 7 p.m., you called me on my cell phone. Chris, you're good? You're still good? And I'm like, yeah, I think I'm still good. And so it happened. So I think that's what really made me, go forward.
And you're such an awesome person and such a fun person to talk to, and I love connecting with all of my patients. But certainly you have a very charismatic personality, and it's been really great to get to know you, and especially just kind of your journey and the fact that you love life, and you love life outside of work, and
Absolutely.
you're traveling everywhere for
Yeah.
work. I
Yeah.
know, because you told me what you did, and so it's important, right?
Very much.
And in hindsight, I can tell you this now: you're actually a very challenging patient, because you come in a category of a patient who we call a presbyopic emetrope. That basically means a person who has perfect distance vision
Right.
and has lost their reading,
Yes.
right? So now, as an ophthalmologist or a refractive surgeon, the challenge is this: you're going to give them their near vision, but what if now they're unhappy with their distance vision?
Right.
So any time we do refractive surgery, especially for the surgeon, it has to do with confidence. Am I confident in my measurements? Am I confident in what I talk to about with my patient? Am I confident, obviously, in what the patient expectations are, right? And based on everything that I say, I said, okay, I think we can hit the nail on the head,
And
right?
you absolutely.
So we decided, I know you tried monovision in the past. I said, no, Chris, we're going to go for a balanced approach. We're going to use a panoptics lens, a trifocal lens, which will give you great distance to up close. You may have a small degradation in your distance vision, but how do you feel at
I
this
have
point?
not I have not experienced any degradation whatsoever. And I understand what you're saying, because if one aspect of the vision is really perfect and the other one isn't, the risk is higher. If both are not very good, it's easy to improve on both. But
Right.
if you got one perfect,
Yes.
but honestly, I I have seen no difference in my far side, and 100% improvement in my near side.
How's boating been, fishing been, all of
Excellent,
those
excellent.
things?
I mean, especially for those of you that know about fishing, trying to thread the hook, it was impossible. I mean, I would always have to find the reading glasses.
Yep.
That means you have to take off your sunglasses and put the reading. It was a nightmare.
Yeah.
Now, I mean, you can just, I mean, like when I was 18, just boom,
That's awesome.
it's done, and it's been great. I mean,
Now you're seeing 2015 at the distance.
exactly,
You're seeing
even better.
J1 Plus up
Yeah.
close. No problems driving, no glares, no
Nothing.
halo.
Biggest regret I have, having suffered for 6 years the inconveniences of wearing glasses and not being able to see clearly.
Yeah.
When there is a solution, and
Yeah.
it's such a clean solution, and then on top of it, I mean, the way you do it, the professionalism, when we went through the entire process, everything seemed perfectly timed. You had everybody aligned, nobody was waiting more than they had to. Came into the room, we got the little, whatever it was, to
Yeah.
sedation.
Yep,
It wasn't really
a little bit
a
of sedation,
but
just to relax.
just to relax.
Yep.
I felt 100% the whole time on control. I didn't feel dizzy or whatever. It was relaxed. And the hit was when I was lying there with my eye open, which, by the way, one of my biggest concerns was, what if I move my eye?
Yeah.
Don't worry, because I don't know what you have. It's kind of a suction thing or something. The eye doesn't move. You don't have to be concentrated in not moving the eye.
Yeah.
It's just very natural.
You don't have to do anything.
Nothing. You just lay there, and then when you said, "What kind of music do you like?" and I thought it was like kind of making a conversation, and I said at that moment it was reggae.
Yeah.
And 2 seconds later, I hear reggae through great loudspeakers and pretty loud, which when you're in a surgery, you don't expect to hear loud music.
Yeah.
And it was there, and you were doing your thing. And
I do get noise violations sometimes.
Oh, really?
Yeah, from the surgeons next door.
It was great, the
Yeah.
feeling, because suddenly I'm like, okay, this doesn't seem half as serious as I thought it was.
Yeah.
And it is, but it's when you have the confidence where, as a patient, you see, man, I got nothing to worry.
Yeah.
Nothing to worry at all.
Oh man.
So it was such a great experience. I would, if not because, but I wouldn't mind doing it again.
Yeah.
It's not, you feel nothing. It's super easy. You relax. You're with a friend, really.
Yeah.
And then the same after the treatment, the interaction with Dr. Ahmed.
Yeah.
Same person. He immediately gave me his private cell phone. If you got anything, call me. I ran out of the drops that you have to take a couple of weeks after.
Sure.
And it was already, I don't know if it was already past closing time or it was. And I called him. I said, "What do I do? Can you give me a receipt to go
prescription?
a prescription to go to the pharmacy?" And he said, "You know what? We still got people there, and I'm still here. Just come by after hours." And you gave me one.
Yeah.
So, as a patient, you feel really like being taken care of 100%, regardless of the time, regardless of the situation. And I've never experienced something.
And that's so humbling that you say that. And at the end of the day, I'm one of the first physicians in my immediate family, and I think I always think back to when I was younger and my parents went to the doctor and I'm like, hey, what did the doctor say? And they're not really sure what they said,
Yeah,
right?
3 words.
And yeah, a lot of times now I'm in this position and I'm like, I want to make sure my patients get treated like I want my mom or dad treated, right?
Yeah.
Or my brother or sister treated. And at the end of the day, you know, I love connecting with people, right?
Absolutely.
And that's the beautiful thing about what I do and why I love what I do is because not only do I get to meet amazing people, but then I get to help them see really well.
Yeah, and I can imagine for you, the feeling when you see me and, hey, Chris, how are you doing?
Yeah,
I'm doing great.
Yeah.
I mean, this is awesome.
No, and it's for me after the surgery, I'm always, even though I know the surgeries have all gone well, it's always the anticipation, like, okay, I can't wait to see Chris next week.
Yeah. It's like
opening
opening
how
a present, right?
Exactly. Every patient is like opening a present.
awesome.
I appreciate your trust so much, honestly. It's really great. It's really a privilege to take care of patients, and especially when you put your trust in your eyes that are already seeing
Yes.
well. That's, I don't take that lightly, and I think that it's a really humbling experience for me.
It's been great, and I want to also extend the gratitude to your entire team. I mean, everybody from receptionists to all the nurses. It's always been a joy to come here.
And I really appreciate that you said that because, even though I may do the heavy lifting when it comes to surgery,
Yes.
I'm only as good as the people I surround myself with, and my staff.
Yeah.
I'll put them up against anyone. I love them.
agree.
I love them so much. They're so amazing, and I'm so ecstatic that you're seeing so well. Definitely come visit us anytime.
For sure.
This is your home, and I appreciate all the kind words.
Thank you so much again. Thank you for giving
And
me
then
my feedback.
we got to get to cliff diving.
Let's do it.
All right.
Let's do it. Okay.